Good afternoon, everyone. Welcome to the Healthcare and the ADA, including People with Disabilities webinar series. I am Anne Deschamps. I'm the director of the Mid-Atlantic ADA Center and part of the Healthcare Subcommittee of the ADA National Network. I am your moderator for today's webinar. This series of webinars is brought to you by the Pacific ADA Center on behalf of the ADA National Network. The ADA National Network is made up of 10 regional centers that are federally funded to provide training, technical assistance, and other information on the Americans with Disabilities Act. You can reach your regional ADA center by dialing 1-800-949-4232. Next slide, please. Captioning, real-time captioning is provided for this webinar. The caption screen can be accessed by choosing the icon in the meeting control toolbar as indicated on the slide there. To toggle the meeting control toolbar permanently on, press the Alt key once and then press the Alt key a second time. Next slide, please. Listening to the webinar. If you do not have sound capabilities on your computer or prefer to listen by phone, you can dial 1-669-900-9128 or 1-646-558-8656 and enter the webinar ID 837-2204 3591. And this is not a toll-free number. Next slide, please. When you're submitting questions, you may type and submit questions in the chat area, text box, or press Alt-H and enter the text in the chat area. If you're listening by phone and not logged into the webinar, you may ask questions by emailing them to ADATech, ADATECH at adapacific.org, ADAPACIFIC.org. This webinar series is intended to share issues and promising practices in healthcare accessibility for people with disabilities. The series topics cover physical accessibility, effective communication, and reasonable modification of policy issues under the Americans with Disabilities Act of 1990, otherwise known as ADA. These webinars occur every other month on the fourth Thursday of the month at 2:30 Eastern, 1:30 Central, 12:30 Mountain, and 11:30 Pacific time. By being here, you're on the list to receive notices for future webinars in the series. The notices go out 4 weeks before the next webinar and contain the link to register. I'm really excited about today's webinar. The presentation is going to be split into 4 different parts, and at the conclusion of each section, there will be an opportunity for everyone to ask questions. You may submit your questions using the chat area within the webinar platform, as I said earlier. The speakers and I will address them at the end of each section, so feel free to submit them as they come to mind during your presentation. Next slide, please. If you experience any technical difficulties during the webinar, send a private chat message to the host by typing in the chat window. Type your comment in the text box and enter, and then click enter. Alt-H to access the chat box via keyboard keys, or email ADATECH at ADAPACIFIC.org. Or you may call 510-831-6174, voice or relay. Next slide 3, please. As I said, I'm very excited today because the ADA National Network is partnering with the Telehealth Resource Centers, and I am joined by Molly Brown, the director of the Heartland Telehealth Resource Center, Derrick Ramsey, who is a program director of TexLa, I hope I said that right, Derrick, TexLa Telehealth Resource Center, Kathy Wibberly, the director of the Mid-Atlantic Telehealth Resource Center, and Reid Plimpton, the program manager of the Northeast Telehealth Resource Center. I would like to welcome all four of you. As I said, I'm so excited that we're able to partner with you guys to bring this to everybody. And I'm going to turn it over to Reid.
Thanks, Ann. Sorry, everybody. I lost my mouse there for a second. Yeah, thank you guys for having all of us, and thanks everybody for joining and taking time out of your day to hang out with us and hopefully learn some stuff. As Anna mentioned, I'm Reid Plimpton. I am the program manager of the Northeast Telehealth Resource Center. My job in this beginning part of the presentation is to lay the landscape of who we are as TRCs and some of the resources that we already have available that might be useful to you. So on and so forth. And so on the next slide, just to sort of level set, I've got a couple of business slides here. Disclosures, neither myself nor Molly nor Derrick nor Kathy are lawyers, and we're not providing legal advice. Also, none of us have any sort of financial relationships to any sort of telehealth vendors. That's, I think, one of the bigger perks of the TRCs is that we are truly neutral and unbiased resources to all of you. So on the next slide, just kind of level setting with everybody, the objectives of what we're trying to go through today. As I alluded to, you're going to gain an understanding of who we are as TRCs and what we do both individually as regional TRCs and as a larger consortium. And then we'll talk a little bit about some of what the four of us have learned and seen throughout our work for strategies, best practices, and innovative solutions to ensure the best accessibility for anyone and everyone that wants to use a telehealth service. And hopefully by the end of the day, you feel much more familiar with the variety of options available to you and ready to, implement some new strategies or improve upon things you're already doing. And with that, I think we'll dive in. So on the next slide, this map, I think, helps you understand the TRCs a little bit. There are 14 of us. We are all funded through the Office for Advancement in Telehealth within HRSA, the Health Resources Service Administration. And as you can see with the map, there are 12 of us. All four of us here today are some of the 12 that divide up the map, right? And so the 50 states and 7 U.S. territories are divided up between us. And you can use the color coding here to figure out which team you should connect with depending on where you live. We also have 2 national telehealth resource centers, and I'll explain a little bit more of the distinction in future slides. But whereas the rest of us are here to help you with anything you're wondering about regarding telehealth, CCHP and TTAC hone in on topic-specific things, right? So CCHP, everybody should be thankful for them. They distill the Medicare and Medicaid telehealth policies for the rest of us. You can go there and you can find the details in every state for every modality, so on and so forth. And then TTAC, although I often joke they get to play with toys, they do a lot of work taking the subjectivity out of the technology world, right? Like there's a lot more variation between intraoral cameras, for example, than the size of the camera and whether or not it's Bluetooth or wired, right? Like if it has storage within it so that you don't have to have it transferring to the computer at all times, so on and so forth. And they write white papers to help people work through that type of stuff. I actually am seeing some really helpful feedback on the map that is in the chat. And I'll just call out that I think that's one of the things that all of us are really excited about here is to get to work with all of you and to continue to improve, hone our craft, for lack of a better word. So thank you, Pam. And I am also seeing, yes, I told our prep folks, I talk quite quickly. I'll do my best. On the next slide, it is an overview of just some of the things we do. We are jack of all trades. If you're a physician, if you're a health system executive, a state agency staff, a patient, a loved one of a patient, whoever, we are here to help you with your questions, whether it's policy related, reimbursement related, technology related, so on and so forth. And that morphs into a lot of different resources, which are these bullets and are quite a few of my next slides. And so we can move to the next one. Back in 2017, the TRCs agreed to start working more collaboratively and to have this national presence that we call the National Consortium. So while you have an individual website for all 14 of the TRCs that were just on the map, you also have this one clearinghouse for all of us, right? You can get to our website from here. We work collaboratively and develop unique materials through here. And we also link back to the individual regional and national materials that have been developed here. And we have our own events, so on and so forth. So this is definitely a spot to stop in and get more acclimated with the rest of us. I will call it the experts page. Is something that we have been really doing a lot of work on, and that is providing a little bit more granularity to what we all do. And so if you are looking for, behavioral health, that page will show you who within the TRCs works in that field. If you're looking for school-based health services, so on and so forth. And so it's a little bit of a filter down, so you're not seeing all 14 teams at the same time. On the next slide, just to further explain how the website works, explaining what collections are. So on this website, the collections are basically sub pages, and they're grouped by theme, right? And so four collections that we have currently are listed here. Just the basics of telehealth, considering the overlap between telehealth technology and broadband. We've done a deep dive into some resources for federally qualified health centers, and then I think our most recent and sort of continuing to expand collection would be the unwinding of the public health emergency, which I'm sure all of you are grappling with as well. And so these are each, unique resources, resource pages and collections of resources. On the next slide, just calling out some of the TTAC resources they've developed. I don't always do them justice in my initial description. They have a lot of great toolkits for tech for various clinical avenues, but also for specific device considerations. So this is just a good example here. You find most of that on the consortium website. But you can also, although the visibility is not great, see that in the top right corner, telehealthtechnology.org will bring you to their individual website. On the next slide, just walking again, highlighting some great resources from one of our other national TRCs, the Center for Connected Health Policy. These are, we have our animated graphic there, kind of highlighting what their website looks like. But as you can see in the image and in the bullets here, they have a number of different deep dives or different perspectives on the Medicaid and Medicare telehealth policies, and including video series, infographics, tables, so on and so forth. However you want to digest policy information, they've probably got a deliverable for you to check out. On the next slide, I have a couple more here that I want to highlight work we've done as a consortium, or that some of the regional ones have done that the rest of us have learned a lot from. Health equity has been a huge focus for all of us in the past couple of years, as it became more mainstream to consider telehealth services for your various patient populations. And so each of these bullets, again, are individual resources that we have available, whether it's a kind of a white paper or a literature review, or a link of resources that exist on a topic like the digital navigation toolkit. We have quite a bit on this topic, and we hope to be doing more in the future. On the next slide, patient-facing resources. This is an exciting new opportunity for the TRCs. In our most recent funding cycle back in 2019 was the first time that patients were officially a target audience of us. I don't think any one of us would have ever turned them down before 2019, but we now had an avenue to start making concrete resources and providing a space for them. And so here are some bullets on the national of resources that are available on the national TRC website. These are meant to sort of be printed and or provided digitally directly to the patient, take some of the information burden off the provider, so on and so forth. And we're continually expanding the amount of these that are available in languages other than English. That's something that I think that is where national perspectives helps a lot. We can get a bit more clarity on, the top languages of need and so on and so forth. Next slide is something that I personally am really excited about because our TRC is the host of it, but it's something I'm excited to share with you all as well, because we know that this needs further adaptation and further development, which is why it's got that nice beta text language on it. We're calling it the T3 tool, the telehealth technology test. And it's meant to be a web link that a health system, a provider, really anyone could provide to an individual who's planning to use telehealth services in the near future, and it will help them feel acclimated. It'll provide them some of the tip sheets and stuff I just showed you, but it'll also run their broadband speed test. It'll ensure their microphone works. It'll make sure their video is going to fire up with the proper permission set, so on and so forth. And so this is something that actively can be used and can be shared. I think in the next quarter or two, we are hoping to find a way to loop in screen readers and some of the other software that comes into the assistive world. But the basic connectivity pieces of it for a audio, visual, and internet are all currently live. On the next slide, this is, again, something that you're probably actually some of the first people to get to see, something that we're working on here at NETRC, and then with our colleagues on the consortium level to try to generalize it, taking the lessons learned from developing a community access point or a telehealth access point, right, that anybody could go use because it has the technology and it's a community space that can be reserved. That's a project we have all been working on, and we had the opportunity to work with Perkins Access and Perkins School for the Deaf, Blind, and Hard of Hearing to boil out some lessons learned around that type of installation for individuals with disabilities, whether it's vision impairedness, hearing considerations, so on and so forth. And so on this first slide, just a very basic help people get started on their search filters, right? If you're looking for solutions for somebody that may be blind, here's some software terms you can use, planning for how that works. And then if none of that works, the alternative, right? The point in the workflow, if in case something breaks, walking through that's this first slide. On the next one, I think we continue to look at different disabilities and potential assistive needs for telehealth and technology. And so, again, you can see the disabilities or the conditions and considerations across the top. And then you have solutions and planning terms to help folks get going on the bottom. We are planning on continuing to get deeper, more granular with this, but our first thought was to help people inform themselves. And I am seeing this question a lot in the chat. Yes, the slides will be shared. If there's any delay, it's my fault because I took a while to get them to the ADA folks. So I'll say that. On the next one, I think we are nearing the end of what I've got here. Yeah, so the NCTRC webinar series, each of the regional TRCs and the national TRCs take a turn hosting the monthly webinar and bringing a regional expert or thought leader to the conversation. And so on the third Thursday of every month at 11 a.m. to 12 p.m. Pacific time, I can tell you just because it's always in my calendar, that's 2 p.m. to 3 p.m. Eastern time. You can find an NCTRC webinar happening. If you've ever missed one, there's a YouTube channel where we have at least 3 years of recordings on there, and they get uploaded within 24 hours, I think. So there's a couple of the most recent topics. I believe this month's webinar was last week. TTAC hosted it, and you should be able to find more information about the next one on the website. Next slide. Learning more. I honestly, for the sake of time and for the fact that I've said most of this, I'm going to skip this slide other than to call out that EEP URL link at the bottom. That link will sign you up for the National Consortium Telehealth Resource Center monthly newsletter, where you'll see the monthly webinar coming up. You'll see the new resources we're doing, anything that, as a group of us, we thought was vital that folks saw. And then I believe my last slide, this next one, is just some contact information. Because I know I threw a lot at you, and because depending on where you live, you may want to talk to a different set of us. You can see each of the TRC logos, websites, and phone numbers here. And with that, I'll just say thanks again for taking the time, and I'm going to hand it off to Molly.
Thank you. Anne, did you want to take a moment to see if there are any questions?
Yeah, I think the only questions we have so far are really about the slides being shared, because there's a lot of amazing information here. So I think people want to be able to go through it when they have more time to digest everything thoroughly. So
and the NCTRC website, you could go through that for hours and just keep uncovering layers of great information, and it links to all of our websites. And so if you're only going to end up trying to grab one of the websites, the NCTRC one's a great one, because then you can link to all the different ones from there.
Right, and that's similar to adata.org, which is the equivalent of MARC consortium website for the ADA National Network, and link to all our websites from there. Well, thank you so much, Reid. Molly, you can take it away.
Thank you. And I'll also add, if you access the NCTRC website and have a specific question for your region, they do a really good job filtering those directly to us so that we get connected in that way. I'll go ahead and move on to, as Reid mentioned, the 14 telehealth resource centers are funded by the Health Research and Services Administration. And part of that funding, we have primary areas of functions that we look at. The first is that we do provide one-to-one technical assistance for clinics, community centers, rural areas, large health systems, those that may inquire specifically about questions related to their organization. The second piece, which is what I will talk about today, Derrick and I will talk about today, are more specific to our outreach and education, which is the second area that we focus on. I want to point out that what we're going to cover in these slides just touches on the things that we do, but we thought it was a good example on how we have worked with accessibility and ensuring that we can spread resources to those that need it. Next slide. So one of the things that we have done across many TRCs is we have implemented school-based strategies. These are very good sources of connecting with students and those children that may have needs or be part of the ADA classification as well. Some of the most common services that are in school-based areas include primary care and not more importantly, but in behavioral health. And they are used to address needs that would be considered under the ADA. Grant funds in various areas support training and development for teachers, addressing challenging behaviors, trauma-informed resources, and medical complexities. With community health workers, this is another model that is employed in some areas of community organizations, but then also within schools. And it works to build capacity using this model. CHWs are familiar with community and resources available, and they serve to bridge gaps between teachers, counselors, students, and families to increase access to services. Next slide. Now let's hand it off to Derrick.
So a long time ago, in a career far away, I was a school teacher and then school administrator. I had the privilege of working at an excellent school that was also home to a large population of deaf and hard of hearing students that required interpreters in the classroom. We had a SEBS unit, many other students that were 504 partners. And so my background in education and now in telehealth kind of cross over every once in a while, a little bit. And I saw some great things going on that anecdotally I can share kind of what we've seen and what we know works. The biggest thing that I know from my years of experience in education, public education, is that schools have a good idea of what those students would need and what the families need to be successful in education. And those same things that would help a student be successful in the classroom, the same types of accessibility changes, the same types of things that are offered to them are the same things that would also make healthcare more accessible for those students. They're very aware of what those students' needs are. Also, the schools make a great partner as well for telemedicine because they tend to have some of the better access to broadband in many places in the country. They have very reliable, strong broadband, which makes accessing telehealth capable for some communities. In fact, in some communities that we're studying in our broadband project, they're the only place that has sufficient broadband for telehealth in those rural communities. They often have built-in IT staff that can help sort of on that side navigate, be digital health navigators to help make sure equipment's working and get things set up for them. And they understand privacy laws. They do follow FERPA, which is a privacy law that schools follow about not sharing certain information. It's similar to HIPAA. It's not HIPAA, but when you bring up HIPAA, they will at least have a great starting point. They will have an understanding. They'll have a place to start with when we talk about how to make sure that we are secure and we're not incorrectly breaching patient information or trust. And then generally, a lot of schools, not all, but many schools have access to some health professionals, such as school nurses or other trained staff that have some health training. Some are on co-ops or some have different types of structures, but that makes them a very good target for this. And so I've posted there both anecdotally some of my experiences, but there's also a link there to a study. There is quite a bit of research out there about school-based telehealth, and one of the advantages that it provides is that it keeps students in class. A lot of states, well, at least 6 major states, the schools are funded at least partially on attendance, and many states do a system of ranking, or the schools get sort of graded themselves, and attendance is always a factor. So it's in the best interest of schools to help students get the healthcare they need, but also not have those students missing a significant amount of courses. And so that study there that's posted just talks about, how that sort of coincides in the best interest of both people. So next slide. So a lot of students that are attending public schools, they are protected in a similar way to the protections that you would have under the ADA using a 504 plan. So these are students that are not necessarily, there is special education plans that students that have an IEP would have. 504, Section 504 covers anyone with a disability and provides accommodations just to help them access what they need for education. So it's not changing what they learn. It's just making sure they have access to learn it in whatever way they need that access. It follows the student throughout their life. It even follows them through into college, where at higher education institutions, it does follow a little bit of different rules, but it's a legal document and it helps kind of level the playing field, and it's something that's provided, and there's no cost associated with making sure that students have this. So one of the other reasons that telehealth and school-based telehealth work very well together is a student with a disability would, I presume, in most situations, have a 504 plan. And that 504 plan means that the school is able to provide services that help that student get there. And a very kind of not understood, or remember, this isn't legal advice, but something that we know that isn't well known is that 504 coverage includes persons without disabilities who are related to or associated with a person with a disability. We have a lot of students that had a 504 plan because their parents had a disability, and we were able to provide services to the family. And so there are cases where that 504 coverage, because there are other family members in their home, that it extends to them as well. Being able to access the school through a variety of means of providing services and accessibility options for them. So that's another thing to think about, is we are going to talk about students, but 504 plans also apply to the families. And so this also is another kind of way where, if we're collaborating well with our schools, and of course it takes a little work to reach out and collaborate and talk about it, it may be possible for a student to have a disability to say, hey, we could take the student out of class and take them to their appointment and go through that. And they're going to have access to an interpreter, but it's not the interpreter that's there every day, or it's not the person that's there that sort of helps that student and knows them so well. They build these beautiful relationships, and they know so much about the way those students are feeling. They know a lot about, even when those students are fibbing, they know quite a bit about the students through those great relationships between some of that we saw, and the teachers, the counselors, the support staff and TAs. They build these great relationships, and they really get to know the students at a deep level. And that type of knowledge is invaluable when you're trying to work to make sure that student has great access to healthcare. And so I definitely think that partnering with schools, parents, families, and groups, clinics ought to try to work together, because that is a great resource where it's only in the benefit of all parties involved to try to work together to make sure that everybody has access to that healthcare, and that the families have access to healthcare as well. Because a lot of the clinics that we see that are school-based teleclinics, sometimes they're open to the public, after hours or in different ways. And so they become sort of community clinics, and then they're able to utilize resources that are already in the community. So they're not having to increase the costs and make it difficult or introduce extra barriers where the school already has these resources. Let's go ahead and use them. It's for the betterment of the community and the people there. Next slide. These are some 504 resources. Of course, this is all going to be made available. I curated a little bit about it because you may be interested in it. I know if you work in ADA work, you may already know all of these things, but as someone from education, there's a lot of great resources that talks about what a 504 plan is, and how it works for students, and how it works for families, and how it kind of has a little crossover there to make sure that students are getting what they need. Next slide. We're going back to Molly now. She's going to talk a little more about specific school-based strategies.
So this is an example of a community health worker model that has been established in Southeast Kansas. The community health worker is actually employed by the health organization, but moves between the health organization environment, the school, and then also the community. They sort of serve as a hub, and as I said before, building trust between the students and families, but also the specialists, the providers, any sort of social work, case management. They're also equipped with different tools that can be used to access telebehavioral health services. They build trust in the community. They're familiar with the community, but they serve as the conduit that helps link families, students, and then the clinicians and service providers as needed, depending on what the needs are. There's a very strong social determinants of health approach embedded within these as well, which includes training for the community health worker, but then also opportunities for teachers. Right now in this area, they have developed using the ECHO model, trauma-informed care training for teachers, along with behavioral health and other areas that are of need to help equip teachers with the ability to observe and see when needs are not being met, and then connect to the community health worker. Sort of this gigantic feedback loop that occurs so that no child or student or family is kind of caught in that gap. Next slide. So this is what I mentioned a minute ago, the Project ECHO model. For some of you that may not be familiar with it, ECHO stands for Extensions of Community Health Outcomes. It's actually a case-based learning model, and it's based on telementoring. So in this figure, what we're seeing is this what we call a hub of specialists, providers, subject matter experts that come together to provide about a 20-minute presentation on a very specific health or sometimes cultural, behavioral matter that needs to be addressed. Those that are in attendance are from all over the community area, whether it's rural, nationwide, statewide, depending on who is interested in this topic. They create a peer network within these communities so that they can learn during the presentation, and then they can go back into their communities and sort of deploy what they've learned. Within the case section, typically participants can bring a case, a very specific, de-identified. They remove any sort of protected health information or anything that might be related to FERPA, as Derrick talked about. And they can bring a specific situation and say, hey, this is what something that came up. This is sort of new to us in our community. And the subject matter experts or the providers or those that are part of the hub team can then work on it. And they all kind of come up with solutions. And then those participants go back into their communities or organizations and implement some of the things that they've learned. Next slide. This is an example of how we provided an echo specific to telehealth and disability. We partnered with the Southeast and Great Plains ADA centers, and the format consisted of a 20-minute didactic presentation, which was specific to accessibility and disability and resources and things that are out there, basically in education, and that a lot of information in that 20 minutes. We then provided 2 case presentations because sometimes in this model, you may not think of something that you're ready to share immediately as a participant. So we do like to come with examples that can reinforce what you've learned in the presentation. And there were 2 presentations. One involved speech therapy telehealth appointments with a person with Down syndrome, actually, and moving from in-person speech therapy to telehealth. And we learned a lot of things within that case related to things that worked and things that didn't work. And then the second was primary care, somebody that had multiple, an older adult, somebody who had multiple, some chronic care issues in the height of COVID and needed to be able to continue with their care, but needed to do it through telehealth. In both instances, a family member was able to intervene and really help facilitate the telehealth appointments. But it also opened up for discussion within the participants on how better we could increase accessibility and what it would take on the user end to be able to fulfill these appointments. We had 18 attendees, and we had the attendees were anywhere from nurses to social work, the CHW, as I mentioned before, educators and providers. And in many of these echoes, all sorts of organizations may attend: clinics, hospitals, some educators from universities, and then the behavioral health networks, of course. Next slide. This is Derrick.
Yeah, and so there is a lot of work in digital health navigators, which is a new type of idea. Being TexLa, where Texas is a big focus of our area, so I have a map there of one that we've seen in Texas that kind of shows there. This is another resource that a lot of times they're grant funded or they have foundational funding. They're groups that can reach out and try to kind of bridge that gap between, how do I get on a patient portal? How do I, access the medical terminology? How do I talk to a doctor? How do we set up appointments and how do I make my equipment work, right? Do I have the right equipment at home? Those types of things, they're great. And so there's a lot of excellent programs out there where you may be able to reach out to a digital health navigator in your area. And so I posted 3 as examples, but if you go online, there's a lot more. I have a vested interest in this topic because I'd really like to see this work. It overlaps some with what we talked about with the community health worker. It's like a community health worker, but also they have more IT background and infrastructure to work with people. And so this is another thing that you would want to, if you were trying to set up and provide telehealth services and you needed more help on this side, this may be a great resource for you in your area. It may not. It's not currently equitably distributed. There's some areas that are just, they have nothing, and some are blessed to have a lot of options. But it would be one of my first steps is I would say, hey, we know we need help with this. Let's go back and see if we have digital health navigators in our area, who can service this. And sometimes they don't even know that they're digital health navigators, because we look at people like libraries, where librarians and they've taken a new role and they're really working a lot with technology. And there are people who are literally like, they know that they're a digital health navigator. They're funded to do that. They understand the sort of marrying the concepts of all the health related needs with all the technology related needs. And that's kind of we don't want those barriers to telehealth to be that we just don't have that competency or that digital literacy to understand things, because there's a lot of terminology that gets thrown around, and having that really helps a lot too. So this is just another arrow in your quiver another opportunity, maybe another tool in your toolbox that you might could reach out and you might could get some help with if you're struggling, if that part of it. Next slide.
All right, I guess I can jump in.
Yeah, Kathy, before you do, sorry about that. I'm wondering if you want to, or I'll be happy to summarize the issue that was put in the chat for everybody else to hear about the interpreter, because I think that's an important issue to bring up.
Yeah, so Karen made a comment to the speakers that everyday classroom interpreter is not always the appropriate person to handle interpretation for healthcare or behavioral health appointments. And so I put in the chat, yes, that is absolutely correct. So oftentimes the classroom or educational interpreter is not well versed in the medical lingo or the behavioral health lingo. And so there is a subset of training that and people can get certified as healthcare interpreters. And so there is a subset of language that if we really get into that deeper dive conversation with a medical provider, that interpreter may not be well versed enough to do that type of interpretation. And then there is also the emotional connection issue, which, you know, oftentimes interpreters are trained to just interpret and not get emotionally involved, but oftentimes that does not always happen because you're in a school with a kid day after day. And so you are very enmeshed in the family and the day-to-day lives of that child and that child's family. And so there does need to be some kind of backup and just take a little perspective on, you know, is this the right person to be interpreting, let's say, a very sensitive, like, you know, a child abuse investigation or a mental health intervention for a domestic violence situation. That, you know, it may be better to have an outside interpreter. So really thinking through that is an important issue.
Yeah, and I want to point out, you know, because I brought it up, it's part of my point is I've just anecdotally seen the power of leveraging that relationship with helping to understand the student. Like, let's say they're in the classroom all day with this interpreter. That interpreter can provide some good information to the school nurse and to the family about how a medical condition may be affecting their ability to get through school, to be successful in school. And so I do understand there's some layers to having the right interpreter for the right place. And I definitely think it's still a great idea, though, to that relationship, while it can be too close for certain interactions, it also can be helpful. And you really want to judge it based on the case by case. Every state is different and every interpreter is different. Every student is different. But also if you have a school that is, let's say they're very focused, like our school, we had a lot of interpreters. They may be a resource to reach out to say, hey, do you have any interpreters? Do you know any interpreters that have that level of certification that do that? They may also be another great resource for you as well, that they have access to that, because if there's going to be a clinic and they're working with schools to set up a clinic, you know, that may be something that they work with and they add that as well. Like, hey, that could be part of the 504 plan. And keep that in mind. And if a school is starting up a telehealth-based clinic, this would be a great thing to bring up with them, is just to say, like, hey, if you guys are going to do the clinic and you guys are working with interpreters, let's make sure we get this type of correct interpreter and have that training available.
Yeah,
There's
thank
also
you.
a comment in the chat about related to more cultural competence of your interpreters. And so comment about the American Samoan community and, you know, bringing in an interpreter from the mainland really didn't understand the cultural context. And, you know, I would basically say approach this as you would ESL. You know, that's another kind of way to look at this. You know, people with disabilities also have a cultural context within their disabilities. The interpreter also has a cultural context within, one, their understanding of healthcare, and two, their understanding of the culture that this child or adult or patient is in. And so really paying attention to that sensitivity is really important, as well as, you know, just being able to communicate, because effective communication also brings in that cultural context.
And I'm thinking about, you know, our community health workers, the role of community health workers to partially is to be they're a connector between the cultural and the the community that they serve. A lot of times they're representative of that community. They speak the language of that community. They're there to be a friendly face in what otherwise is not always a easy to navigate place. And digital health navigators are similar as well. And I would imagine a world in the future here, and we're just spitballing perfect world here, where you could have someone who's a bit of a community health worker, a bit of a digital navigator, and maybe an interpreter, or maybe, someone who provides, services that help to sort of help with that 504 ADA, or a translator. That would be great if we had in some communities. That would be amazing to kind of hit them all and make them a sort of super user.
Yeah, I think, I'm going to talk a little bit about some of the other resources a little bit later in my presentation, but the whole term cultural broker is significant for the disability community as well as the cultural ethnic kind of outside the country piece as well. And so we can't discount how important that is. And there was a comment in the chat also that cultural regional interpretation can be an issue even within a state, and that is absolutely true. I live in Virginia, and if you are from Southwest Virginia, especially if you're from the Appalachian region, there is a whole different set of vocabulary that means different things. And so especially when we were dealing with the COVID epidemic, there were some words that if you said them, you just basically turned people off right there. And there was no further conversation because it was, the ears just turned off. And so, to not be aware of that can be a real barrier to communication.
Great. Well, thank you, Kathy and Derrick. I think that is a critical issue. So Kathy, take it away.
All right, well, I'm going to talk a little bit about the specific disability resources for telehealth that there have been. So next slide. The first one was mentioned already when we were doing the overview of the consortium, but we did develop a fact sheet. It's a 2-pager front and back, and it really is a very nice handout. So if you are a person with disabilities or a caretaker, or someone who works with people with disabilities, it's a really nice one that you can provide to your healthcare provider. It's short enough that they would actually read it. It basically does an overview of what are your legal obligations, what's the definition of a disability, and then some general recommendations for providers. Next slide. Then also on this fact sheet, there are some effective communication hints and tips for different types of disabilities. So whether you are hard of hearing or have hearing loss or deaf or blind, have vision loss or have physical disabilities. So it goes through each of those sections. Now, this is not a deep dive. It's just a very quick and easy overview, but it's enough to at least get some providers thinking, especially if they're not used to working with patients with disabilities. So it's a very nice tool. There's also another very quick and easy 1-pager that was developed by the Northwest Regional Telehealth Resource Center, which is just ADA telehealth considerations. And that is a very simple, this is what it means to have access. This is what it means for a person with vision to have access, and hearing loss and memory attention deficits and mobility. So again, these are just very nice, quick things that you can hand to a provider to at least start bringing some awareness and attention to some of the issues that they may have. Next slide. And I will put those links in the chat, or someone can while I'm talking. So when you want to get into a deeper dive, the North Carolina Department of Health and Human Services has put together an amazing set of guidance documents, and the National Consortium of Telehealth Resource Centers participated in that, really reviewing the telehealth parts of that. So their guidance documents, there's a whole set for healthcare providers, and they're specific to patients who are deaf, hard of hearing, or deaf blind. So next slide. So there's one huge fact sheet. It's very long, but it really goes through everything from what are the different types of communications accommodations, how it's delivered, what patients can ask for or need within different contexts. So it really lays the groundwork, and these guidance documents are specific to each subset of disability. So if your patient is deaf, if its patient is deaf-blind, there's a set of fact sheets for each of those. Next slide. So one of the really nice things that this does is it puts it in the context of a healthcare visit or healthcare appointment. So if a hard of hearing patient is making an appointment, what are the considerations? So before the appointment, what needs to be done? There's this lengthy checklist. During the appointment, what needs to be done and considered? Following the appointment, what needs to be done and considered? And that's for each subset of the types of disabilities. So next slide. We also have a whole set of fact sheets that talk about American Sign Language interpreters and how their role plays out in a telehealth visit. And so it looks at the whole patient rights piece. It talks about HIPAA and interpretation. It talks about different platforms and technologies that can be used effectively for ASL interpreters to participate. And you're seeing, a use of that right here in this webinar. It really gives some communication guidelines and a whole checklist for healthcare providers who are working with patients as well as their interpreters. So next slide. We also have some other resources for providers. So at my telehealth resource center, which is Mid-Atlantic, we, during the COVID era, not that we've completed that, but during the actual pandemic response piece, we developed some community response toolkits on how to leverage telehealth for different populations and subpopulations. We looked at very vulnerable populations like the homeless and others. But one of the toolkits that we developed was for individuals and families with developmental disabilities and autism. And so there's a very nice multi-page handout on what are the key considerations if you're working with people with disabilities, how do you use telehealth for people with disabilities and with autism. And so that is a toolkit that's available free of charge. We are also currently in the process of this initiative with West Health Institute called the Center for Excellence for Telehealth and Aging. It's not specifically for disabilities, but as you can imagine, many of the resources and the guidance and principles and guidelines are going to apply to people with disabilities as well, because as we all know, age-inclusive design of telehealth would include people who are experiencing hearing loss or having vision issues or having mobility issues. So there is a whole set of resources related to all the published studies and toolkits that we have been able to find related to that. So you can search the whole resource library, and that is free of charge for use. There are a couple of toolkits that have been developed specifically for this purpose that are free, but you would need to actually register to access those free resources. And the registration, of course, is free. On the next slide, there's also a set of resources, not just for providers, but resources for ASL interpreters. So the guidance for the actual interpreter themselves. So next slide. Again, the North Carolina department did a fantastic job putting together, what does the workspace look like for an ASL interpreter? What should it look like? What does it mean to interpret on-site at a facility versus doing it by video? Next slide. They also have some great resources for patients. And one really great resource is their communication accommodations request letter. You can download these fillable documents, print them out. So you can do it for PC, for Mac, with or without an Adobe Reader. And basically it's a form letter. It has space for you to fill out, what accommodation you need. There are check boxes, so it actually lists all the different types of accommodations and you can check it very easily. It asks for like what the patient's preference is. So you might say, I want this type of interpreter. These are the various kinds I can use, but this is my preference. And so you can provide all that. It also provides a healthcare provider advocacy letter. So you can print that out and also bring that to your healthcare provider. And it's a great way to say, hey, these are my rights as a person with disability, and these are the things that you should be providing by law to me. And so coupled with that accommodations letter, I think it's just a great resource, whether you're having a telehealth visit or an in-person visit. Next slide. So there's also the set of patient guidance for individuals that are deaf. There's obviously the rights to communication access, but there are also some really nice communication strategies resources that you can download. So what you can do to help your virtual health visit go well, there's a condensed version and a full version. There's also a technology infographic that's setting up a successful telehealth video call. And so I definitely invite you to peruse, to explore, to download these things, to make them available to providers, patients, and caregivers. They are wonderfully made. Next slide. I also mentioned that there are specific resources for each type of disability. So those who are deaf, those who are hard of hearing, and each one of those goes through the technology. So for those who are hard of hearing, that technology piece, there are many things. So there's how do you amplify a telehealth video conference and phone call? How do you use captioning technology for a mobile phone call? How do you use CART? How do you connect a hearing device to audio during a telehealth video meeting? How do you improve your internet and device functioning for a telehealth visit? And we all know, if you're doing any kind of sign language or you're using another technology on top of the video conference, you're going to need more bandwidth. And so how do you make sure that you have all the bandwidth that is necessary for a successful visit? So next slide. So for patients who are deafblind, there's some very interesting pieces on technology related to that. So one resource is making medication labels easily accessible for telehealth appointments. So oftentimes you think, oh, well, you can just have your medication bottles like sitting around and that way you can just show them, prescriptions. Oftentimes patients don't remember their prescriptions. And if you are a deaf-blind patient, being able to then share with your provider what you're taking, what the dosage is, what all of that is not always the easiest thing to do. And so there's some very nice resources around how do you do that for a telehealth visit. Tips for navigating patient portals for deafblind patients, which is challenging if you're not deafblind. So I can't even put myself in that position to figure out like how a deafblind person would access the typical patient portal when I have difficulty sometimes with these patient portals. So great resource there. Tips for setting up a webcam for those who have little or no vision, and then troubleshooting telehealth technology. So again, worth your time to download and read and share. Next slide. There are some other resources that are available through these links. So the Hearing Loss Association of America has some very nice videos that were developed during COVID. Many of these resources were developed during COVID and have the context of COVID, but they're still very good resources. The National Association of the Deaf also has a number of resources, and then TDI also has a number of resources. Next slide. All right, so those are the kind of a subset of resources that are specific to telehealth and people with disabilities. And I mentioned this in our kind of brief conversation with the other panelists, that I am imagining that there will be a whole lot more resources under development over these next 2 years, following that North Carolina model, where we're going to take a subset of resources for people who have mobility issues, who have cognitive issues, memory loss issues. There are a lot of really nice kind of Alzheimer's and other memory loss clinics that are done by telehealth, but very few have developed a full complement of resources for the general public on doing this. So I think, being able to tap some of those specialists who have been doing this for years and years and getting those resources is wonderful. So before I go on, is there any other questions or comments about the resources themselves?
I actually had a question while you were going through it, Kathy, and you might have been planning to address this later on. How do you guys reach out to remote rural areas that don't have bandwidth and don't have Wi-Fi, and a lot of people don't have phones or computers? So how do you reach out to those areas?
I'm actually going to hit on quite a bit of that in my next set of slides.
Okay, all right. I was a little premature. I'm sorry.
But I can give you kind of a big picture piece. So one of the things that we are really trying to get a handle better on are what we call access points for telehealth.
Yeah.
So this has been a piece that has been in the works for a long time, prior to even the pandemic, but really prior to the pandemic, it was oftentimes thinking about like healthcare facilities, right? So if I were a specialist in like a large academic medical center, how do I tap into, let's say, a rural health clinic or a FQHC that's in a rural area so that my patient can go there instead of, coming all the way to me, which might be an hour, 2 hour, 3 hour visit. And now we're really looking at community-based access points. And so I will talk about that in just a second.
Great. Thanks,
So
Kathy.
that's probably a really good segue into this next portion, which is
Perfect.
engaging non-traditional partners. So this is kind of a call to action, and it is something that I would really encourage you all to think about, particularly for the disability community. So next slide. So I really encourage people to think outside the box. We think about healthcare facilities as access points, but we are now with telehealth thinking more and more about non-healthcare facilities as access points. And so examples of that are libraries. I know here in my region, Delaware, all of their public libraries now have kiosks. They are internet accessible, they are private, so you can close the space down and have privacy, and you can then connect to a video visit, whether it's with your healthcare provider or with your lawyer. Because what we are discovering is that during the pandemic, many things flipped to virtual, and so then legal services became virtual. And then we're realizing that people in rural areas can't access those legal services from their homes if they don't have bandwidth. But we're also realizing that people who are, let's say, in situations where there's domestic violence or child abuse, they might have that abuser living in that home. And so where can they consult a lawyer? They need to find someplace else to go. We also have situations where people are living, 8, 10 people in a 2-bedroom apartment. And where are you going to find privacy? So those are some of those things. So we're creating then access points that are internet access points. So that could be libraries. We already talked about schools. For rural communities, many of them participate in what's called the Main Street Initiative or Main Street America. This is where rural communities are financially assisted with building up their Main Street so that it becomes a revenue stream for tourism and for keeping people in the community and not leaving the community to find jobs. And oftentimes there's an abandoned storefront that is eligible for Main Street America funding. And that storefront could be turned into, let's say, an access point for a telehealth visit. It could be, have some kind of spaces that are private, that are not all glassed in so that people can peek in, and that could have a router with a Wi-Fi connection so that people can even just bring their own devices and connect and use that facility. We're also seeing a little bit of a movement, though not as much, with using nursing facilities, retirement homes. So many of those do have internet access and actually have conference room space. The downside with that is oftentimes they are already strapped with workforce shortages, and so are not as capable of helping you with that access, or helping patients who show up at the door to get to a room or a conference room. But it is a potential space to explore, and if you could bring in someone to help them navigate that, then that could be a potential opportunity and a place to use as an access point. On the next slide, I also encourage you to think outside the box as to what healthcare providers already go to your patient with disabilities home that you could partner with. So emergency medical services is one of those areas. And so we are seeing communities do mobile integrated healthcare, community paramedicine. Those are two models. In rural areas, it's a little bit more challenging in that many of the EMS agencies are volunteer, but it is also an opportunity to create an actual paid position in those EMS agencies. That's for sustainability of EMS in these rural areas, so they're not raising funds through bake sales, which is a true thing. But it also gives people who are interested in healthcare a position where they can actually stay in the community and work. And so those are opportunities. We already mentioned the community health worker movement, and that is one area where you're using people who are local into the community and training them, providing them the skills and tools. And they could be the ones going to the homes to facilitate a telehealth visit for someone with disabilities who may not be able to navigate all of the technology, or they could actually help bring accessibility devices to the home. There are also home health agencies, and we have often not tapped into them as ways to provide healthcare, because oftentimes they are affiliated with like a hospital or health system. And they can only be used if a patient has a certain type of condition and they are actually assigned to home health. But there are some home health agencies that are independent out there where you can tap into those resources and say, if I'm a provider and I want to contract with a home health agency to go into a home and do a quick medication check and then set up a telehealth visit, that is a possibility. So those are people who are already going into the home. Next slide. Also encourage you to think outside the box about who is going to that patient's home that's not necessarily in the healthcare space. And we are seeing a lot of traction right now with conversations and pilot projects around using things like US Postal Service workers, FedEx workers, UPS workers, Meals on Wheels programs who are already going into homes. And also both Uber and Lyft prior to the pandemic had developed a healthcare service line. Their line was specific to transporting patients to healthcare appointments. And so a lot of large hospitals and health systems contracted with these folks to do that. But on the flip side, there is nothing wrong with using these same services to deliver healthcare technologies to the home, accessibility technologies, as well as internet access technologies. So if you need to have a visit with someone and they cannot leave the home, whether it's because of mobility issues or some disability that would not allow them to, let's say, drive during office hours, there's nothing wrong with using Uber or Lyft to deliver, let's say, an internet access device and an iPad to that home, and then to have that device picked up after the visit. So those are all kind of outside the box, but opportunities to really use and leverage the services that are available. Next slide. So also thinking outside the box, we talked about the digital navigators, but oftentimes in rural communities, as well as in urban communities, there are people that can serve as digital navigators that are volunteers. And so you could tap into the Boys and Girls Clubs, you can tap into the Boy Scouts and Girl Scouts, because who better at digital navigation than teenagers? And if you train them to become trainers, then they can do that. But I also think about scouting as a great opportunity, because both the Boy Scouts and the Girl Scouts have badges that are related to ASL, that are related to nonverbal communication, kind of extra languages. And so you can tap into some of those scouts who have already earned those badges and use them as your digital navigators to provide them the digital navigation training. There's also AmeriCorps that has a series of volunteers. And I think AARP actually has volunteers as well. And I know at one point they were organized. I don't know if they are now, but really think about, who could serve as digital navigators, who, even if you are someone who can't pay someone to be a digital navigator, who can get trained, who are volunteers already in those communities. Next slide. Well, that is kind of the bulk of what I have, and we want to thank you for inviting us and just open up the time for any questions or comments.
Thank you so much, all four of you. This is great. Kathy and everyone, we do have a couple of questions and issues to discuss. Emily L. had asked how to ensure access to telehealth for immunocompromised patients when doctors and hospitals are pushing to go in person when it is not an appointment that is necessary in person. I don't know which one of you wants to take that.
I can take a small part of that. So, part of that is educating the provider. And oftentimes providers want to just go back to, quote unquote normal, because that was the status quo prior to COVID, and they want to go back to, the status quo prior to COVID. But we also know that landscape has changed. And they have the ability to now, get reimbursed for these telehealth visits. It will save them time ultimately. It will save them on no-shows ultimately. And so we do have some resources that are for providers that can say, like, what's the value to you? What's the benefit? And so that may be one way to help them understand, maybe I don't want to go all the way back to in person for everything. Undoubtedly the benefits to patients is a big one as well. And I don't know if Molly and Derrick have anything to add.
Yeah.
Well, I would add too, one thing you could do is use any sort of surveys that come your way from your provider. And if, at the very least, you're at least getting your voice heard and you're getting it out there. There are folks, they do read those, they look at them. They have quality assurance and quality improvement folks within health systems that pay attention to that. May not move quick enough for you, but it's a way that you can at least answer those surveys that come your way as a patient. Typically, they should have a open box at the end that says, "I would like more telehealth services and offerings within my provider's office." That is one way to get it heard. The other way is to voice it when they go to the in-person appointment. If there's no other option, is to also voice it when they're exiting or making their next appointment. Those are ways that patients and clients can at least advocate for themselves in those ways. At the same time, there are advocates that are out there at the policy level too that are moving things at the state level to ensure some of these coverages. We did have a question in the box about the Medicare services that might be ending towards the end of 2024. And so there's ways that you can, that at least providers and service providers can advocate at that level too. Our job is to provide the resources and education so that advocates can build their case. But those are some ways that you can, get your voice heard.
I want to tackle the question a little bit that, they said, what do you do if we've got patients that need telehealth and they can't seem to find it? And Kathy mentioned, advocating for it. This is going to sound a little corny, maybe cheesy, but, if you're dealing with providers who say, well, I don't know about telehealth, right? Obviously, there's a great group out there they could reach to that would answer any of their questions. For telehealth, we have experts in the room. That's the advocating point of what we do as TRCs is if you're running into people that need to access telehealth, but the providers don't feel like they're equipped. That's what we'd like to help you do. We'd like to connect with those providers. We would love you to refer them to us so we could answer their questions and we can help them. Especially also, I would say, if you ran into a provider that said, hey, I want to do telehealth, but I'm not sure about an interpreter there, or I'm not sure what I need to do with someone who has mobility issues, or if they're not sure, you have resources. While we have the ADA centers and we have the TRCs, that's what we're really equipped for. So please if you're out there in the real world and out there in the big world and you're trying to help advocate for somebody and you're trying to spread the information and you run into that and you say, well, I can't, or we don't do that, send them our way. We will help them. We will educate and we will provide guidance.
Well, and that's such a good point. The other thing that's important to acknowledge here, and what we've seen at the ADA centers, is there are a lot of medical professionals who don't really know very much about disability at all. And so the medical professionals need to be educated about disability and about what potential accommodations that their patients might need to be able to participate, including telehealth visits as well. So it's really, I find that the healthcare industry needs a lot of education about the whole arena of accommodating patients with different disabilities. And, you know, Steve, I appreciate your point. Steve Gordon made a point that I think it's, you know, volunteers are a great resource, but as we've noted a number of times here, they cannot replace qualified interpreters when one is legally required. And, you know, I think the most important thing when it comes to this is ask a lot of questions in order to be able to find what is necessary to create effective communication and to make sure effective communication is happening. And you know, unfortunately, there are a lot of limited resources here too. And this hasn't really come up, and I'm not sure if any of you guys have come across the shortage of interpreters and qualified interpreters in the country, particularly during COVID. Do any of you all want to comment on that?
Yeah, first I want to put the context of volunteers and scouts, or put that in context, because my slide was really related to using them as digital navigators, not as healthcare interpreters. So these are great opportunities for, you know, someone like a Boy Scout or a Girl Scout or any volunteer to help a patient set up the technology, to understand the technology, to, you know, figure out how to access the patient portal. Those are things that volunteers can do in the digital navigation role. Definitely not using them as healthcare interpreters. That would be a whole different level of service.
But there's value if they already have an ASL background. There'd be a value there if they had an ASL background, but they also were able to work as the digital health navigator. There's just extra value there. It's how you can identify groups that may have overlapping skills like that. Like we said with the school interpreters, they may have that overlapping, you know, we're not going to replace the health interpreter, but because they have some overlapping skills, it may be of use.
Good point, Derrick, and great differentiation, Kathy. I think when you speak this language, it's easy to overlap things and things to get lost in translation. So I think there was another issue. Our Amanda was asking if ADA health professionals assisting in educating Uber and Lyft on transporting service animals and other disability-oriented aids for patients who need to travel. Would you guys like to address this? I know that this has also been another big issue that we've seen at through the ADA National Network, the lack of education among Uber and Lyft drivers about people with disabilities and what they need.
I'm not aware of
from
yeah, go ahead.
Kathy can clean it up probably because she's got probably more experience with it. I would say that in my experience, that's a health system by health system determination in terms of what the relationship is with those two companies, and what the expectations are of the drivers for those companies. And I think you touched on something that I've seen press on there recently, which is, you know, maybe Uber and Lyft drivers don't have adequate training. I would say that that question is open for more than just ADA considerations, right? Do they have emergency medical services training? Do they have the ability to properly transport someone who may have their leg in an immobilizer because they just had an outpatient, a knee surgery or whatever it is. Those are open questions. And I would say, in my experience in the Northeast, health systems that are using those companies are negotiating and sort of setting that up as a part of their agreement and collaborative contract structure. I don't know, Kathy, if you have more thoughts on that.
Yeah.
Yeah, I was going to say something similar that, I'm aware of certain hospitals, health systems approaching Uber and Lyft to, make sure that there's some training involved with their healthcare side of the Lyft Uber driver piece, but I don't know of any national effort. And so maybe this is, if you are part of an advocacy organization or agency, this may be an opportunity to really do some education around that.
Yeah, I agree. Great. Everybody is very grateful for all these amazing resources. Okay, Joanna has a question on follow-up question, resources on exam hybrid of telehealth, such as RN at home for pulse BP, especially in states like Florida, where masking even healthcare is limited. I ask because I have a pain management physician who's requiring a COPD patient an in-person exam, but refuses to wear an N95. Do you have any suggestions?
So, the first thing to look at for this is basically the way I'm reading this, and I may be interpreting it wrong, so you can help me out here. And this is an excellent question. So there's a patient with COPD. They're at a higher risk for all sorts of things. We do know there's still COVID and some other things out there, flu and other things. My mom has COPD. My dad has COPD. So I know this is kind of, they're very at risk population. But they are being required to attend in-person exams. The provider is the one that's not wanting to wear the mask, not the patient, is what I'm reading it. And like, how do we do that? Is this the only provider they can see? Is there other providers available? Is there a, for this type of service, it may be that they could look at, that's a communication issue and a separate issue, but I would definitely say, like, hey, we've got a provider locator on our website where they can look for other providers in the state that would provide that through telehealth services. Perhaps if they're uncomfortable with their doctor not providing if they don't like their doctor, that's definitely one reason telehealth is powerful. If you don't like your doctor, you're not stuck, because in a lot of these rural towns, if you don't like your doctor, that's it. That's the one doctor for 300 miles. So telehealth opens the door to say, you got to be, providing quality services, because there are other doctors that will come in and do it for you. So that may be like a tricky situation, and I don't want to provide any like specifically, but I would, that's a great example of where telehealth provides access to other providers. And even if that provider won't do telehealth, there's someone else who is probably willing, and it's just about finding and connecting the patient. And there's some, issues with insurance and all kinds of other stuff and whatnot. But that's definitely something to keep in mind. And I know that because you said that you work in pain management physician, I know that the DEA released sort of some like rules for public commentary. They were inundated with tons of public comments. And so they've sort of had to go back on that and let things kind of simmer, and they're working on new rules and regulations. So that's also a whole other like ball of yarn. And I think we have some great resources on it. We did a NCTRC. There's some information on our website. We've got some webinars in some of our groups. So maybe we can point you to some more specific resources about that. Or you can go in, put that question, like these types of questions. If you put them in on our website, you get more one-on-one time. We can give you some more attention. We call it TA, but like, these are great questions that I would love to answer, but like they represent like what we do every day. That would be great. Put it in on the NCTRC, or we can connect you with the Southeastern TRC or whoever can best answer that.
That's great. Derrick, and that's a great plug for the TA too. I think we want to encourage that. And before we stop, Matt Steele pointed out, we haven't, Matt, mentioned the role of the Department of Justice and the guidance that's recently been issued from the Department of Justice and HHS regarding telehealth. And if you guys want to comment on that, and I'll just also let people know that at adata.org, we have a telehealth resource document as well that we actually got the input from the telehealth resource centers on. So there are a lot of resources out there. But do you guys want to comment on that document from the Department of Justice and Health and Human Services?
Sure. So the Department of Justice issued guidance, I think it was earlier this year, on non-discrimination in telehealth and what the federal protections are to ensure people with both disabilities and limited English proficiency are basically entitled to the types of services. And so the documents that we had created related to things that could be provided to healthcare providers basically cite some of this guidance, like these are the things that are civil rights protected for individuals. And that guidance document, I'm gonna actually put that, see if I can put
it's
I think I got it.
And Derrick,
it's in there.
Derrick,
I sniped you and got it in there.
Yeah, but they do address like the things about HIPAA and how you file a complaint. And I think it's a really good document for people to really understand their rights.
Great.
The other thing that we didn't include in this slide deck that we can follow up with to have our ADA friends share out, I would say, is a checklist of internal, like what you already have, right? What's in the facility? What do you have for staff capacity? What do you have for technology? So on and so forth. But it's built based off the guidance that I think his name was Matt had referred to, right? Like a health system is required and expected to be able to provide these services. And so it's sort of a bulleted list of helping them understand where they're at, how, because then they can make their path forward from that. And so it might take me a little bit of digging to find it in a non-PowerPoint format, but I know I have it, and I'll make sure that our ADA friends have it to share out with you all.
Great. And I'm finding the link to our document related to telehealth, and I'll put the link in there. I just can't, I'm not like everybody else that can talk and put links in chats at the same time.
We also are all using more than one screen, and we haven't admitted that to you, but this is how we all
Thank you, Reid. I appreciate that, but I own my inability to multitask. I just want to make sure everybody has the resources that they need. You guys, this has really been amazing. The amount of resources is really incredible. There is something for everybody here, and it seems like healthcare providers need, as well as the disability community, we all need to connect to all these resources so we can help educate each other. And I guess my one last question for you all, do you think you receive more calls from healthcare providers or people with disabilities, or it's really hard to say?
I think many of us in our regions receive all sorts of different types of inquiries depending on where we're located. Some of us are in bandwidth or broadband deserts, if you will. I think all of our regions touch some level of that, so we may get a lot of that. I can say we do get quite a few policy and reimbursement questions because of all the changes that have been happening. In terms of with disabilities, I think it just depends. It depends on what may arise in somebody's clinic in terms of questions, maybe something that hasn't come up yet. I'll lean on the others to comment a little more within their areas, and some have been in the field a little bit longer than I have, so may have a little bit more historical that they can share. But I think it just really depends on what's going on, and especially with the declaration of the end of the public health emergency, has factored in as well. So I'll turn to my other.
I would say also, we really need to know, like, they, because of the public health emergency, certain portions of telehealth were greatly expanded. Some are temporarily expanded. A lot of those expire the end of 2024. Keep looking into the space. There's very likely going to be some movement in telehealth space where we keep kicking the can down the road, but a lot of these things may end up being added to policy. There may be changes to policy. So that's a great way to keep in mind, is that nothing is currently on like super solid ground, which is why our CCHP group is really useful. It's why our NCTRC websites resources are very useful, because all of this could move pretty quickly in one direction or the other, and could impact a lot of things. There's a lot of crossover with like the DOJ and the lot of areas like that. There's a lot of crossover here, and so keep looking in that space. But if you need a resource, it's very likely we have it. If
Yep. Thanks,
you need a
Derrick.
resource
I'm
and we don't
sorry,
have
we're
it,
going to go over
Yeah.
time here. I apologize. We realize that a lot of you still have questions that we haven't had a chance to answer. You know how to reach out to the telehealth resource centers. You can also contact your regional ADA center at 1-800-949-4232. You will receive an email with a link to an online session evaluation form. So please complete that, because we value your input. Thanks again to Reid and Derrick and Molly and Kathy. This was a great webinar. We really appreciate the opportunity to collaborate, and you're sharing all your knowledge with us. And thank everybody out there for attending today's session. Have a great rest of your day.